Hello, everybody. It's Sabina Miller again with help for seniors, information for seniors. You know my philosophy. If you feel okay, you have to get out and go someplace. Now, today we're going to talk about if you don't feel okay. I have a bad back. I have a bad leg. You know, at my age, all the parts have gone. And so I've been going to physical therapy for a few years. And finally, I found a place that really helped me. It was unbelievable. And so my guest today is a gentleman named John Dragon. Welcome, John.
Thank you very much.
And he is a physical therapist. And, you know, I'd like you to tell my audience, my viewing people, about physical therapy. But first, I would like them to know something about you, because my attitude is you go to the doctor, you know nothing about him, so you never can feel really, really comfortable. If you know something about people, you know, you're more comfortable with them.
Okay.
So, why did you want to be a physical therapist?
Well, I was first exposed to the field of physical therapy when I was in high school because of a sports-related injury I had. And I had a very good experience with my therapy, and it kind of planted a seed in me. And when I got into college, I took some courses in biology and physiology and anatomy, and I took on a greater interest at that point. My mother is also a registered nurse, so I've been around healthcare professionals. I've always had an interest in helping people get through tough times physically, and I think some of my mother's nurturing attitude spilled over to me in some way.
Yeah, my feeling is it was definitely an influence.
I think so.
But what exactly is physical therapy?
What exactly is it? Well, physical therapy is
treatment of injured parts of the body?
Licensed healthcare professionals that specialize in helping patients reduce their pain and improving their mobility. That's the short answer. Now,
do they have to be referred to you by a doctor, or if somebody watching says, oh, maybe that's it, maybe for these backaches I need physical therapy, then can they call directly, or do they have to be referred by a doctor?
Well, the answer is actually yes and no. They may call and come into the office directly without a referral. New York is one of the states that have direct access to physical therapy, meaning a patient can contact a physical therapist and receive treatment for up to 10 sessions or 30 days before they would need to go for a doctor's referral. Certain insurance companies have their own requirements to get reimbursed for your therapy. So that is where the referral comes in from a doctor.
Well, you know, I have Medicare and I have a wraparound to Medicare.
Medicare requires a referral from a doctor.
Oh, believe me, I have referrals from orthopedic doctors. You know, so Medicare pays and my wraparound pays, but I have back problems. But thanks to you, I'm mobile, I can do everything, and in fact, I go for my therapy on Monday and Friday, and I think Friday was a Memorial Day.
Yes.
Was that? Yeah. Because going Friday and Monday, and after very short time, I really started to feel good. And then Friday was a holiday and I didn't go, and by Sunday I was saying, oh, tomorrow please come.
Oh, okay.
But you know, you have to stick with it, and ultimately...
Yeah, the hope is that we get you to a point where you can manage your condition on your own, with your own exercises.
And I was there a few years ago, and you know, I forget how old I am, and if the dining room table, the cleaning lady moved it when she vacuumed and she left, I think nothing of pushing that table back. Well, you know, I mean, I'm used to it.
Good for you.
No, it's good for
It's
you.
good for me also.
So, exactly, you know, if you go to an orthopedic doctor, you know what they do, you know what a gynecologist does, you know what a brain surgeon does. What is physical therapy, actually? If somebody said, what do you do when you go there? Just exercise?
Well, physical therapists use prescribed, selected exercises that they have evaluated your condition and they feel are appropriate for improving your condition.
But it's not just all my responsibility, because when I'm there, I am put on, I don't know what it's called, I'm put on a table with a hole for my face, and then the table is tilted,
Right.
and I get heat pads on my back, and then the back is manipulated. And
Yeah.
what blows my mind is that when, you know, you or one of the other therapists goes to massage the disc that's pressing on the sciatic nerve, none of you feel around. Bing, you go directly to it. Does it stick out, or you just know where it is?
Well, we've been doing this a while. We know the landmarks. I think we understand where to go, where your problems are, and that's part of the evaluation process. And in addition to exercise, we use manual techniques as well to achieve the same outcome. So there's modalities that are used. There's ultrasound, electrical stimulation when it's indicated. Manual therapy is a big part of what we do. In addition to therapeutic exercise, our practice pushes a lot of exercise because we feel it's very important for people to get up and move. A lot of their problems are made worse by lack of activity. So, but that doesn't mean you can just go indiscriminately into doing exercise. You have to understand what it is you're doing and how to do it properly, and you have to understand that some of the conditions that you may have are certain exercises are contraindicated or not
so
appropriate for
you-
that condition.
If you don't do it under supervision of someone like you who knows which exercises to do and which not to do, you could make your condition worse.
That's correct. Absolutely. And that's where we come in. We help guide people to the appropriate exercise and hopefully get them independent with it so they can follow through with that at home and maintain their improvements.
Are all physical therapies the same, or?
No, practices specialize in different demographics, different types of patients. Also, some practices gravitate towards certain types of insurance. You'll see some practices specialize in no fault or workman's compensation. You'll see practices focus on a certain demographic, maybe pediatrics. In our case, it's geriatrics. You also see practices that focus on sports medicine and sports-related injuries. There are practices that will more or less take anybody who walks through the door, which is fine also. But more and more now you're seeing physical therapists sort of gravitate or specialize in an area.
Well, it's like when you say you do geriatrics primarily. Did we mention the name of your business, which I am so impressed with, because I don't care what age you're at, that's what you want. You want to tell us the name of your practice?
Age Well Physical Therapy.
Now, who came up with it and why and how?
Oh, I'd like to say I came up with the name, but my partner, Mark, came up with the name. And I came up with a lot of other names that he was polite enough to say gently, let's keep thinking about it. And then he came up with this name. Actually, we were on a flight to a conference together, and a light bulb went off in his head, and he wrote it down. And I think it was perfect, because you want to have the name of your practice tell about what it is that you do in a very concise way. And I think that's what this does.
Yeah, see, when I heard Age Well, and then when I got in there, I didn't realize that it was primarily for seniors, but I looked around and I was with my own crowd, you know, and I thought, well, the younger people probably come in the evening, they're home taking care of the babies, you know, that kind of stuff. I didn't even realize, I know you have a lot of older people, and I got to say this, either they don't really need physical therapy, or you're helping them because, or the physical therapy is helping them because they're in good shape.
Yeah, it's surprising what people can accomplish when they're encouraged to do their best, and you can tell them it's safe to do this, and you should do this, and
Yeah.
you give them the green light to do it.
It's got to be very satisfying for you, though, when you see somebody limping and, you know, and then 2 months later they're coming in, they got a little pep in their step, and it makes
Absolutely.
a difference.
It's very gratifying. That's why we do what we do.
And I must say, because I've had so much physical therapy, I've broken all my parts. There's nothing original about me.
Oh, you're original.
I have been to many, many physical therapy places, and it was a blessing the day that I
Oh, that's
found
nice of
you.
Thank
And
you.
as I say, you know, you're not only specialized in seniors, but you're patient, and, you know, you give us some exercises to do at home. Do you find that most patients do those exercises at home? It's just a little, you know, try to do this, try to do that.
We always give a little more than what we expect people to do in terms of home exercise, in terms of the amount of exercise and the frequency with which we recommend it, knowing that human nature is such that you'll have a day where you don't feel like exercising. We all have that.
Yeah.
So we recognize that, but we try to encourage them. We check in with them each visit. How are your exercises going? And can we go over a couple of them so we know if they're doing them properly or not, and who's doing them. And we always just try to give them a lot of encouragement to continue to do that, because that's really important. We can only just do so much in our office.
Yeah.
It has to be followed up at home.
It has to be, they can't leave your office and get a flat tire and get down on the ground and change the tire. It's got to be gratifying for you to see them come in, and if they do their exercises there, and if they do what you tell them to do at home, it's got to be gratifying for you to see them, you know, a couple weeks later, not dragging with, oh, you know, but come in, good morning.
No, it's true. Very gratifying, and it works. And when they do their part and we do our part, it works. We have a good success rate with that, but it takes two.
Do you feel that physical therapy is changing? How long are you practicing?
23 years.
Oh, you're new at it. Has it changed?
It has. It really has. The education level is increasing. The requirements to get into physical therapy school is very competitive right now. It was competitive when I went to school. It's even more so now.
People are living longer.
People are living longer. There's certainly a nice job opportunity, job security. This phenomenon known as the graying of America. Baby boomers are now reaching retirement age. I think the youngest baby boomers are in their early 60s, and the oldest baby boomers are in their early 70s.
Are you a senior at 60 or 65?
I don't know the definition necessarily, but I know that you know, if you look at something like Medicare, 65 is when you would be eligible for Medicare. So
Okay,
that's sort
because
of the,
my son is 60 and my daughter is almost 59. And someone said to me, oh, your son's a senior. I said, well, isn't that 65? And they said, no, 60.
that's a good Google question. I don't know. But I do know that a lot of statistics on falling and senior-related issues and
Are more
concerns are
seniors-
geared towards 65 and over population.
Okay, but are more seniors falling than did 20 years ago?
No, I think there's more seniors now than there were 20 years ago, and it's becoming an increasing concern. It's certainly a concern from a health standpoint. I believe the statistic is that anybody who's 80 or over, half of those folks will experience a fall every year at 80 or over. That's quite a shocking statistic, I think. Every 11 minutes in this country, a senior is treated in the emergency room for fall-related injury.
Wow.
Yeah, and it's certainly a financial strain on the system as well. So fall prevention is a big part of what we do at our practice and many practices.
Well, also, seniors, and to you it may be very subtle, but seniors now live differently than they did 25 years ago. 25 years ago, you retired, you stayed home, you did a little work in the garden, maybe you babysat the grandchildren, you know. And now, seniors are working longer, they're doing more after they stop working, they're going on vacation, they go hiking, they go bike riding.
But they're more active, they're living longer, and they're generally healthier as well.
Yeah, I was going to say, I imagine it's a healthier lifestyle than just sitting.
Absolutely. The sort of the traditional notion about exercising when you're a senior was that you don't do that, it could hurt you. And this is even the medical model. People didn't encourage their patients to exercise years ago. Now we know that not exercising is a risky behavior, not the exercising. So you need to exercise.
If seniors are living longer, then to me common sense dictates physical therapy must be changing some, because you have the older population with damaged bodies.
It certainly is changing. People, as you said, are more active now. They have different goals. One thing that we do with patients is we always interview them the first visit, and we understand what their lifestyle's like and what their goals are like, because people all have different interests, different hobbies, and different desires out of their therapy. So we're dealing with that on a daily basis. More active people, but with that comes increased risks as well. Fall prevention is a very big concern for us as physical therapists, and talking to our patients about that. We do fall screenings to assess their risk of falling on everybody who comes in the door.
Wow.
So we get an idea of should this person receive some education, and give them some exercises they can do on their own to improve their balance.
Wow. Now, when you say you do an assessment, where does your patient come from? Does a doctor refer him? Does a neighbor refer him?
That's a good question. Traditionally, the doctors refer the patients. Sometimes doctors will refer a patient to a physical therapy practice they know has a good reputation. Sometimes they may have an affiliation through a hospital system that they'll refer their patient to. Our practice gets a lot of referrals from friends and neighbors and family members, which is what we like, because we think that's the highest compliment.
And I cannot remember, because I'm coming to you at least 10 years. How long have you been down the street?
13 years.
Okay, probably 12 years. When I say coming to you, I came to you and then I didn't see you for 10 years.
Which is what we like. We don't want you to be coming, and we love to have you, but we don't want, the model is not to have you come all the time. We get you better and you manage your condition.
I went in awful shape. You put me on my feet to the point where I traveled. I went to Easter Island. I, traveled all over. I am busy. I am active, and recently I had a fall, and so I'm back. But it's well, obviously, you have patients, and then you don't see them for a while unless they hurt themselves again, and they're probably going to as you get older.
Yeah. You asked how physical therapy is changing, and in one way it's changing is that people are now establishing relationships with their physical therapist as you would with a doctor, your primary care physician, your orthopedist, your neurologist. And when you have a physical therapy need, you go to that physical therapist. You have a relationship, they understand you, they know you, and you feel comfortable with them. And this is one way that physical therapy is sort of evolving into more of a direct access, autonomous type of healthcare professional.
Now, how important is it if someone has a bad fall, a senior? I would imagine if you hurt enough, you're going to go, well, maybe you'll go to the emergency room. You go to your doctor. But I think unless your children say, you know what, I'm going to make an appointment with my physical therapist, see him, how do they get to you?
Well, they can call our office. However, if
No,
you,
I mean, how do they know, oh, I should be in physical therapy, not just...
well, hopefully you would first, if you have a fall, have an X-ray to make sure there's no what the injury is, if there is an injury, and then your doctor would hopefully refer you to physical therapy and maybe ask the question why you fell. Not only what injury did you sustain in the fall, but why did you fall? Ask questions about that, investigate a little bit, find out if there's a risk factor with you that's making you fall or putting you at risk for falls because you want to prevent the next fall.
Well, I'm not there this time because of, well, this time, you know, I keep coming back like a bad penny. This time because of a fall. I have a disc that presses on the sciatic nerve. And so my orthopedic doctor said, go. And I don't, and you know, don't understand how you relieve the pain. Mm-hmm. It blows my mind.
Well, we have been trained in this, and we know what to do. I'm not going to go into the different techniques with you, but there are ways to stabilize the lumbar spine, to release pressure that's on a nerve root that's causing pain, and this is what we're trained to do.
And basically, it's like going to a doctor. It's covered by insurance.
Yes, yes. Physical therapy is largely covered by insurance. There's few insurance companies that don't.
But if they have a fall or they have something bad and someone says, you must go for physical therapy, do they have to be referred to you by a doctor?
Most seniors, if they have Medicare, would need a doctor's referral, yes. Yeah. They should see their doctor, again, and express why they think they may need physical therapy. And if the doctor agrees, they'll write a prescription for physical therapy.
Are there any children in physical therapy?
In our practice, no. But
I never see them.
There are practices that specialize in pediatrics, yes, absolutely.
Wow.
Yeah, definitely. There's, young people are involved in sports. There are neurological conditions that can be alleviated or mitigated by physical therapy, and there are people that specialize this. The American Physical Therapy Association offers 8 different board certifications for physical therapists. Like a doctor would become board certified in neurology or orthopedics or urology, physical therapists can get board certified in 8 different areas. You can ask me what they are. Well,
I'll tell you what. I don't want to put pressure on you. Tell me 4 of those.
I could probably get to 7. Orthopedics is one. Sports medicine is another.
Why is orthopedics and sports different?
Well, I'm not a board certified sports or orthopedic physical therapist,
Okay.
but I know that sports has its own world where you understand the mechanics behind the different sports and how people get hurt.
It's like going out for a dairy dinner or a meat dinner.
There you go. And there's also neurology you can get certified in, geriatrics, which I received my certification, I think, in 2006. There's electrophysiology. There is women's health.
What is electrophysiology? Oh, it's using machines and...
Yes, there's different diagnostic tests that physical therapists are now using to help hone in on what the problem is. EMG testing, neuromuscular ultrasound to image different injuries within your body. And these are the people that specialize in that.
Wow. And you're basically geriatrics?
Yes. That's
And
where
your
our specialty is.
Partner, Mark, is...
Yes, he's a, there's another certification within the field of geriatrics that you can obtain through the American Physical Therapy Association. And you can become a certified exercise expert in the aging adult. And what that means is that you have a very good understanding of the types of problems that seniors may have and how that impacts their ability to exercise. There's also age-related changes that occur within our body that are a natural course of aging that happen whether you exercise or don't exercise. The tissue changes. And you have to understand this in order to prescribe the right dosage of exercise. Otherwise, you may hurt somebody, you may do too much. You want to do enough to affect the change you need, but you don't want to do too much to cause tissue injury.
See, I always wonder when you're massaging someone or helping them exercise, and they go, ooh, ooh. Sometimes,
is that a good ooh or a bad ooh?
Well, that's what I wonder, because sometimes you stop and sometimes you go right on and say, that's okay, it's okay.
Oh.
So how do you know the difference?
Are you asking me if it's, do I believe in the no pain, no gain adage? I don't believe in the no pain, no gain. When you have pain, when you're participating in exercise, you should stop the exercise. You should not, pain is a sign that your body's, it's a way of communicating that something's wrong. You're hurting some tissue, you're hurting a joint, and you have to stop. This is something that we're very tuned into when we're working with patients because of the demographic we work with. When we're working on people, we may hit a trigger point or a muscle spasm that causes a momentary increase in pain, which is something they may have to work themselves. We have to work through with them. That's different than the no pain, no gain.
I have a question.
Yes.
Before I get massaged for the pain, you put hot pads on. What does that do?
Well, moist heat is often used before manual therapy to soften the tissue, increase the blood flow to the tissue, make it more elastic, reduce some inflammation. Chronic inflammation responds well to heat. If you have a chronic injury, you're going to want to reduce that inflammation by use of heat. So it sort of prepares the tissue for what we're going to do with it.
Okay.
And makes it more effective.
Yeah, sorry, I thought time is almost up, and I heard a little noise, and now that means I know time is up. But I do want to thank you. First of all, I want to thank you for putting my body in better shape than it should be in. And I want to thank you for coming and talking to our seniors about how to age well.
Well, thank you for inviting me. I've enjoyed this.
And I know that they've learned something. Thank you again.
Thank you.
Aside from thanking the physical therapist, my physical therapist, I want to thank the audience for watching. I hope and I'm sure that you have learned something about how to age well. Thank you.